before we get started, for the folks who are new here, I just want to let you know that the Department of Human Services does not record or distribute this briefing, so please take a moment right now to make sure that you are recording if you are going to need that, and we'll get started in just a minute. Okay, great. Looks like we've got everybody in here, so we'll go ahead and get started. So welcome and thank you for joining us. My name is Jen Amundson, and I work in media relations here at the Department of Human Services. This briefing is part of a series requested by the governor to keep the media up to speed on our actions to prevent and disrupt fraudulent billing in the state of Minnesota. There's been a lot of interest in the work that Optum is doing to assist the department in creating an enhanced prepayment system of processing Minnesota's Medicaid claims. And today we can share the first phase of that work for you. An embargoed version of the reports we'll be talking about today was offered to those of you who RSVP'd on the call or to the call and agreed to the embargo. If you missed that invitation, please drop me an email or a note in the chat and I'll get those reports to you as soon as I'm not talking anymore. The Minnesota Department of Human Services Deputy Commissioner and Director of Medicaid, John Connolly, is here today to walk us through the headline results of those Optum reports and provide some context about what these reports do and don't indicate. So thanks as always for joining us, John, and welcome to the briefing.
Thanks all, good to be with you again this week. And I think the headline message here is that for the last 3 months, Optum has been assisting the Minnesota Department of Human Services as it develops an enhanced prepayment review process for Medicaid fee-for-service claims. It's a complex task that takes a lot of time, a lot of data, and a lot of collaboration to set up right. But at the end of this process, Minnesota will have a state-of-the-art system for checking Medicaid claims for error and potential fraud before payments are made. Optum is providing us with analysis and recommendations to help DHS identify, first, direct recoveries, which are instances where payments were made that did not follow our policies and procedures. Second is cost avoidance. Those are savings we may be able to realize by implementing prepayment review and enhancing that prepayment review through this process. Third is policy refinements, opportunities where changes in policy and procedure could change or create rather significant savings. This new system uses advanced data analytics and even artificial intelligence to check billing against policy and procedure. But it's not magic. Anytime you build a system with infrastructure like this, you need to make sure you are programming in the right policies, rules, regulations, and assumptions to get accurate results. DHS anticipated there would be vulnerabilities in some of our services, which is why we identified the 14 high-risk areas. This report makes specific suggestions about how to improve claims processing and make policy revisions. We're working to ensure services are delivered and payments are made proper. To do this, Optum used 192 data analytics on the 14 high-risk services to analyze where savings could occur. However, each data analytic generated a separate savings calculation. That work revealed patterns of claims and early intensive developmental behavioral intervention services, which includes autism services, that didn't match clear policies or procedures. Those two data analytics flagged over 90% of EIDBI claims in the 4 years studied. But right now we have to understand why such a high percentage of claims would raise red flags. We may need to clarify policies so claims that deserve to be approved are not unnecessarily flagged, and providers may not have the training they need to file claims properly. Other policy or procedural issues may also warrant further investigation with these findings. But that's how it works. This is the first set of reports from Optum after just 90 days of doing this work with them, and over the next 9 months, we will continue to refine our work on the prepayment system. If we identify past activity that looks suspicious, it will be investigated and referred to law enforcement if necessary. As this process continues, we'll be as transparent as we possibly can. We're not just building a prepayment review system, we're working to rebuild trust with the people of Minnesota. It means we will have to show our work as we move forward, being willing to admit that we don't yet have all the answers. Right now, Minnesota is doing more than any other state when it comes to minimizing the risk of fraud, hardening our systems against bad actors, and aggressively investigating suspected fraud, waste, and abuse, and referring cases to law enforcement when we find wrongdoing. Our goal is to win back trust by making Minnesota a national leader in program integrity. Thanks, Jen, and back to you.
Thanks, John. So that was an overview of the reports, which we have sent to almost all of you at this point. We do have time for some questions. So if you have a question, please raise your hand and we'll acknowledge you and you can come off mute. Oh, AJ, that was very fast. Well done. So AJ Care, you can go ahead with your question.
I think one of the big things that jumps out is if Optum could find this in 90 days, why was the agency not spotting some of these vulnerabilities over a period of years?
So I think that's a good question. The first thing I'd say and repeat is that this is an initial analysis. So these are initial findings. They have, a series of analytics based on their kind of proprietary systems, in addition to looking at our system and designing new analytics that are specific to Minnesota. But I think to answer your question directly, so it's an initial review of claims. So this is a kind of a first pass, so to speak, after 90 days. But to answer your question, I mean, we did not have tools, I think, up to the task of responding to the increasingly complex fraud schemes that we have been grappling with, particularly in the last year or so. And so I think this is a step in recognizing that we needed more. We have gaps that we have to deal with, and this is a really key step in closing those gaps and using Optum and this new technology to be able to respond in a way that's more sophisticated as the fraud schemes become more sophisticated. But the prior kind of tip-based way that we investigated fraud or potential program integrity concerns, it just wasn't up to the task. And we'll still rely on that tool, but now we're adding new tools that are more sophisticated, like the sophisticated fraud schemes that we're finding.
Thanks, AJ. Let's go to Corin at Fox 9. Go ahead.
Yeah, thanks. In the reports, I noticed that the redactions include all the vulnerabilities as well as the recommendations for change. So I'm wondering, obviously the legislative session starts here in less than 2 weeks. I assume they'll be able to see those and we'll be able to eventually report on them. But I'm just wondering, when are we going to see these? How are we going to know what the vulnerabilities are and what the recommendations are to fix them?
Sure, that's a fair question, and we expected it. And according to the Minnesota Government Data Practices Act, we are basically redacting security data. And the major issue and consideration with that is that we don't want to share information with bad actors, with fraudsters, that will tip them off to how we're looking at fraud and looking at risk or vulnerability to fraud. So the last thing we want to do in this process is to provide information that helps people steal from the Minnesota taxpayer. So we're trying to balance transparency and provide as much up-to-date information as transparently as we can with you all and with the public, but also protect information that could present more risk.
Thanks. Let's go to Alex DeRozier with the Pioneer Press. Go ahead. What's your question, Alex?
Appreciate it. I was just taking a look at the executive order or the Walls order on this back in October, and it says, purpose of this audit is to detect suspicious billing activity, to scrutinize the use of public funds. And I'm just wondering, is there anything in this that stood out to you as far as suspicious billing activity goes? I mean, I think you had mentioned the autism services program, but I mean, what kind of suspicious billing activity did this audit pick up on, if any?
Yeah, so I think a couple of things. Optum was looking at perhaps billing trends that might have raised some questions, things that may not have seemed clinically appropriate, and did that, of course, by looking not only at their own frameworks and analytics, but looking at our own policies in our provider manual, for example, the Minnesota Healthcare Program's provider manual, and looked at billing relative to some of the guidance in there and recommended, I think, some additional policy changes that would help us reduce risk or vulnerability. And so I think those are a couple of examples where we could add additional restrictions or additional frameworks around claiming to prevent or reduce risk in that regard. So it could be, again, something that's not clinically justified for the service or the person being served, depending on how their service plan looks or what their needs are. It could be, again, remarkable consistency in billing that wouldn't make sense kind of based on human experience, things like that. So I think those are just a couple of examples that Optum may have looked for.
The other question I had, just as a sort of a follow-up, just because this was mentioned in the October release. Does this pause of payments continue? I suppose it's now been overrode by the additional pauses in payments that are as a result of the DHS stuff. So maybe maybe I didn't need to ask that question, so I can leave it. I'll leave it there. But there was a pause of payments back in October, right? And so I suppose now with other pauses, or how does that work? Because I remember at the beginning of the audit there was a pause, right?
So I might try to sort out a couple of things here. There are a couple of types of pauses in payments that have occurred. I think one is a payment withhold for individual provider organizations if our Office of Inspector General has a credible allegation of fraud. So those are just broad payment withholds for that provider organization, again, based on those findings and that information. There was then a temporary suspension in processing claims that began in December, late December into early January, that was put in place in order to begin this new enhanced prepayment review process with Optum. That is no longer in place, so providers are now getting paid biweekly as they have been. There's just a 2-week delay in payment. So after the end of each 2-week billing cycle, there's about 2 weeks that will pass for Optum to do this enhanced prepayment review, for DHS staff professionals to review flagged claims from that prepayment review, and then for us to release payment to the providers. But that payment is happening every 2 weeks again now.
Thanks. I know it's kind of all over the place, but just an explanation of the pauses was appreciated.
You bet.
Okay. Thanks, Alex. Let's go to Eric Shalou at KSTP.
Hey, good afternoon, everybody. My apologies for just getting to look at this right before we walk in. Sir, could you give me a thumbnail sketch of how much money was detected that has raised red flags about where it went and what it was used for?
So, I mean, there is a total billing amount for the services that was looked at. But this is really looking at if we were to change policies in certain ways to limit billing or put certain restrictions on what our systems will process, there would be potential savings associated with those policy changes. That's really what this is identifying. To be clear, it's not an assessment, a forensic investigation of program integrity problems specifically or fraud specifically. So it's really an indication of, looking at different clinical guidelines, or in our own provider manual, for example, recommending limits perhaps on billing. And some of these might be able to be implemented administratively. Others may require an act of the legislature. And so we'll review those recommendations and process them accordingly. But it's really recommendations that could yield potential savings and reduce risk or potential program integrity concern if we were to implement those policies.
So is that the $52 million number, or am I looking at
that is one of the numbers in the report? Yes, that if we were to have instituted these changes, that would have been one of the potential savings yielded.
Great, thanks. Let's go to Alyssa Chen at the Minnesota Reformer. Go ahead, Alyssa.
Thanks. My internet is a little shaky, so let me know if I cut out. But 2 quick questions. One, sorry if you already said this, but so will the policy recommendations the unredacted policy recommendations be given to the legislature?
Certainly, if we are proposing policy changes to the legislature, those are things that we'll have to share those policy changes with them to implement them.
And then also to implement them. Sorry.
I think the other thing I might add briefly is if we take administrative action, we would also, of course, notify legislators of those changes, so they understand kind of how the program is operating, and importantly, how we're responding to program integrity either risk or making program enhancements.
So Alyssa, it sounds like you have reverb going every time you open your mic. If you want to type your question in the chat, we'll come back to you and we'll go to Aaron at WCCO in the meantime.
Thanks for taking my question. Hopefully you can hear me. When you look at the 14 programs, are you able, John, to say which one is the most vulnerable out of the 14? And then kind of the follow-up there is, we've heard many people say this, that it's not just small changes that are needed here and there. This is going to be a complete overhaul for a lot of programs. And so how long should Minnesotans expect that to take?
I think that's a really good question. So I think the first thing I'd say is that certainly we will work with the legislature as needed in the upcoming session and share the different recommendations that we have coming out of this to strengthen the programs or the services where we can. And again, some of these changes will likely require legislative action. And I think to the extent that we can work with the legislature in this given session, we will do that. To the extent that we have future findings as our work with Optum proceeds in the coming months, we have a year-long contract with them. We will develop more recommendations, throughout the year and possibly into the next session as well. So it just, and of course, we will have a new governor next year, and the new governor will have ideas as well, I think, as a result of this work, and those findings will be shared with the new governor as well. So I think it will likely be a multi-year effort, but certainly in the upcoming session, if there are items that we can work on in partnership with the legislature, we'll do that.
Great. And then could you just say which of the 14, I guess, from a high level, really raised eyebrows as, okay, this is our most vulnerable program in that category?
Yeah, so I don't know if I can say with certainty at this point which service, for example, is the most vulnerable, but we did call out, of course, the Autism Services Benefit, EIDBI, as having kind of the largest number of findings in terms of flag claims through this analysis. So that's one that certainly stood out in the report, and one that we kind of shared proactively with you all. But again, this is a first pass. It's an initial analysis after 90 days, and we'll have to continue to refine our understandings of what's been flagged. And again, there are savings figures associated with each of the analytics. And so we'll have to, again, look at those and sort out what exactly that means in terms of risk and the share of claims that need further follow-up.
Thanks for those questions, Aaron. I do have Alyssa's question in the chat. Her follow-up question is, does DHS have access to MCO or non-fee-for-service Medicaid claims?
Yes, we do.
Great. Okay. Eric, you had a second question over at KSTP. Go ahead.
Sorry, we had some tech issues when I asked you the question about the dollar amount. So I just wanted to ask you again, if you could break down for folks the dollar amount that has been identified from questionable billing. Could you put the dollar amount on what they found?
So in the report, there's the $52 million figure, and then the broader figure in the other tables. I think we'd have to follow up with you to kind of process, but there are a variety of different elements in there in the tables that we can process with you. But again, it's not necessarily inherently problematic billing. This isn't a forensic analysis of fraud. It is, again, a look at claims that need further follow-up. So I think there isn't a final figure, a figure we can rest on. I know there have been a lot of different numbers placed out there for public conversation about the total amount with respect to program integrity concerns. We don't have that at this point. Our investigations, certainly within the Office of the Inspector General, continue. We continue to have findings. We continue to refer findings to federal and state law enforcement. The U.S. Attorney's Office, the Attorney General's Office are investigating. So there will be more. It's a fluid process, and this is just a point in time set of indications at this point. It's not a hard measure.
Thanks. We'll go back to Aaron for a final question.
Great. I know you said, you will recommend, I guess, share information with local law enforcement so that they can investigate. has anything like that come from this initial 90-day analysis? Did you pass along any findings to law enforcement from this first 90-day look?
I don't know that I can answer that question at this moment. I think we're still looking at the information and processing it, but I'm not aware with certainty yet if any findings have been passed along to law enforcement from the Inspector General based on these findings. I don't know that we're there yet in terms of how we're processing these data.
John, there's a couple questions in the chat. Annie Baxter at NPR is asking who we're working with given so many resignations at the U.S. Attorney's Office. James Clark sort of addressed that on Monday in our briefing, but I don't know if you can synthesize what he said, or I can get back to Annie.
No, I think that's a good question. At this point, we're not really sure, to be forthright with you all, who's receiving the information. We're forwarding the information as we always have in the usual channels. So who's receiving that information and who's investigating at the U.S. Attorney's Office, we're not sure at this point, given how many folks have departed that office.
And then the last question we'll answer is from Mary Murphy at Forum. And she's asking, does this change anything about the accuracy of the potential for the $9 billion in Medicaid fraud? That was the estimate from the U.S. Attorney's Office. So this is an opportunity for us to answer that number.
Yeah, so I might repeat in some way what I said earlier in answering one of these questions, which is that we don't yet have a number. So we don't know that to be true, and numbers that are placed out there at this point are speculative because investigations are continuing. We continue with our own investigations with the Office of the Inspector General at DHS to find more credible allegations of fraud. We're referring those as required by law to law enforcement, again, both at the Attorney General's office at the state level and to the U.S. Attorney's Office. And fraud will be investigated as a crime through a criminal proceeding, but it is a crime with intent. It has to be proven through a legal proceeding. So at this point, we don't have a figure, but certainly as we develop more understandings of risk and areas where we can change policy, we will provide that information to you. But I think at this point, it's premature for us to place a number on the figure. But part of what we're trying to do with these enhanced analytics and with this work, this enhanced prepayment review, is to provide a better understanding of potential savings and different policy changes that we can make to prevent fraud, to tighten up program integrity, and to tighten up our policy frameworks around these services.
Thanks, John. We appreciate your time today and these answers and your expertise. Those of you on the call who are journalists, we also appreciate your work and are looking forward to your coverage on this topic and all the difficult things that we're talking about these days. So with that, we'll end the call. Feel free to email me with questions that you have as you're working. Thanks, everybody. Have a great day.